So, so good afternoon and good morning. It's still morning. Sorry. Good morning, everyone. Thank you for attending the last in-service today, March 28, 2023, and it will be Jules, and she's going to talk about genomic medication. If you have questions, feel free, if you want to write them in chat or to just save them till the end. Thank you, Jules. It's all you.
Thank you. All right. Hi, everybody. I'm Jules. And yes, today I'll be talking about genomic medicine, but I will also be more focusing on pharmacogenomics and how we use that tool for better patient outcomes in relation to genomic medicine. So a few objectives for today. The purpose of today's presentation, we're going to go over some definitions related to genomic medicine, and how we kind of can use the genome as a tool for genetic information and how that impacts our health. Then I'll go into more about pharmacogenomics specifically, and discuss an example of testing results and how pharmacists and doctors will use the results to kind of guide medication choice. And then I'll discuss some pros and cons of genetic testing, and then we'll end with considering some of the future aspects of genomic medicine and pharmacogenomics, where we're heading, the excitement behind it all. So to kick us off, starting with genomic medicine, basically, genomic medicine utilizes the uniqueness of our genome and how our genome affects our health to guide medical advice with not only treating disease, but also preventing disease in an individual. And so to talk about genomic medicine, I thought it would be helpful to very briefly go over what a genome is, how our DNA relates to our genome, how it kind of briefly all works. It definitely gets complicated, but to take it up briefly apart, starting with our DNA, which is just our basic molecule of genetic information, the instructions for our life. It's made of those four bases you've heard of, A, T, C, G, and they are the instructions of how our body develops and functions. Little fun fact about DNA, if you were to compare two people's DNA, they would be over 99% absolutely the same, but it's that less than 1% differences in our DNA that makes us unique individuals, that gives us our abilities, our behaviors, and absolutely impacts our health. So our DNA is organized into what we refer to as genes. So a gene is kind of this basic unit of inheritance. So a specific gene will be composed of a specific DNA sequence that codes typically to one specific protein. So if you have one gene, and you were to just create a protein based off that genetic information, it would create this one specific protein. And our body is actually made up of 20,000 protein coding genes, or each cell has 20,000 protein coding genes. And proteins in our body are these large complex molecules that really make up every function in our body, in our cells, and our tissues. And then finally, all of that is kind of contained in what we refer to as the genome. It's the entire set of our DNA instructions and therefore our genes in a cell. And everyone's genome is unique, and kind of the interplay between all of the genes in our genome impacts pretty much everything about us, including our health. I also would say it's definitely relevant to talk about these two other areas of kind of genomic medicine. If we're going to talk about genomic medicine, these are very interrelated. In the discussion of genomic medicine, you may have heard the term precision medicine, which is this newer, innovative approach to medical management. So the cool thing about precision medicine is it does take into account genomic medicine and genetic information, but it also takes into account, obviously, clinical information, but family history, environmental factors, even, everything that makes up you and your life. And so the goal is kind of stepping away from this one-size-fits-all approach to medical management and really focusing on the right treatment for the right patients at the right time. And then related to that, pharmacogenomics is an important component of both genomic medicine and precision medicine. But the cool thing about pharmacogenomics, from my perspective as a pharmacy student, it really uses the genome, the information from the genome, to tailor finding the right medication at the right dose that's going to be not only effective to treat your disease, but also safe by avoiding adverse effects. And that's, again, based on just your genetic information. So again, going back to, the idea of precision medicine is trying to get away from this traditional one-size-fits-all approach, because we are not all one-size-fits-all. Based on our genome, we are definitely unique individuals. And so previously, you have this large patient group, they all have the same diagnosis. So therefore, they're all going to get the exact same prescription, the exact same dose, just based on our clinical trials in the past. But we all know from real world experience and evidence that not everybody reacts the exact same way to a certain medication at a certain dose. A lot of people will experience, and now you see that bottom right group, a lot of people do experience a benefit in a drug that is not toxic, but a good amount of that population are experiencing a benefit, but it's toxic. The drug is toxic and not beneficial at all, or the drug it's not toxic and it's not beneficial, it's just doing nothing. So that's kind of where pharmacogenomics is stepping in to address these issues of ineffectiveness and adverse effects. So as far as ineffectiveness, it's actually estimated that 30 to 60% of drug interventions are effective in patients, leaving the other percentage, a large percentage, where the drug is not effective at all. And we see this, I like to think about it in depression, when we try to choose the right antidepressant for a person. That can ultimately be a big guessing game, a big trial and error kind of approach to it. Because not only do a lot of people not find relief on their first antidepressant, it takes a long time to even see the full effect. If you're going to see it, it takes weeks to know if a drug is going to work or not. And so that's a lot of time potentially wasted. And then on the other side, adverse effects. There are 1.3 million hospitalizations every year due to adverse drug effects or drug interactions, some kind of bad drug reaction. I think this is really relevant because as Americans age, we're definitely taking more in medications, and we're just increasing the risk of experiencing a dangerous adverse effects. And so that's really where pharmacogenomics, again, is stepping in to address those issues. I think it's really cool. So I did want to go over an example of how pharmacogenomics can kind of help guide medication selection and medication dosage. A good example I think of, there's a lot of evidence, for codeine and its relation to this enzyme in our body called CYP2D6. So I thought it would be a good example to kind of go over. CYP2D6 is a specific protein enzyme in our body. You may have heard of the CYP450, cytochrome P450 enzymes in our body. They're found in our liver. They metabolize and break down lots of things in our body, including medications. And so this specific enzyme, CYP2D6, is responsible, again, for metabolizing 25 to 30% of available medications, including codeine. Codeine, as we know, is a drug for pain relief, but the thing about codeine, it's what we call a prodrug, and it needs to be transformed into the active metabolite morphine in order to have a pain relief effect in our brain. And CYP2D6 is partly responsible for breaking down, transforming codeine to morphine. However, the gene that codes for CYP2D6 can be variable in our population. So variants or mutations exist in our population where people's gene for CYP2D6 is slightly different and will therefore code and create a slightly different CYP2D6 protein. And that protein may work at a different function than what we would consider the normal or the more frequent enzyme in our population. And so that definitely affects how coding works in our body. And so based on that, so if you get your genetic swab on your pharmacogenomics test and the results come back, we as pharmacists and doctors will categorize you into 4 subgroups based on what variants of that gene you returned back as. So just starting on the left here, poor metabolizers, based on that gene, accounting for about 5 to 10% of our population, are not able to transform that codeine into morphine. So those patients actually will experience no pain relief. And the recommendation is to just use a complete alternative pain relief medication because codeine is just not going to work for you. And then we have intermediate metabolizers accounting for about 20 to 40% of the population. And they will experience some pain relief because their enzyme is kind of working at just a lower function than normal. So the recommendation there would be to increase the dose so you can get that adequate pain relief. Our extensive metabolizers, which is definitely the majority of the population, are able to receive that normal package label dosing of codeine to experience adequate pain relief. No issues there, really. But then we have our ultra rapid metabolizers, which are more rare. They account for about 1 to 5% of the population. But not only do they experience pain relief, but they are more likely to experience these adverse effects. Too much work in the brain can lead to respiratory depression, too much morphine in the brain. And so the recommendation is to definitely decrease the dose or just use an alternative as well to avoid that possible risk of toxicity. So you can kind of see how pharmacogenomics is really important. So a lot of drugs have this relationship with the gene in our body or protein in our body. And because we're all different, we all may have different levels of function of enzymes, and those impacts a wide variety of medications. I think as we see pharmacogenomics grow, you'll see more of its use, not only in pain relief medications, but also in cardiac medications, asthma, depression for sure, and other antipsychotics are related to these genes, these proteins that can be variable. So pharmacogenomics can definitely save us time and money by just letting us know off the bat what a medication might work best in each person. I also wanted to just briefly touch on some other types of genetic testing. I think genomic medicine is this really broad and growing field, and it's kind of hard to define exactly what genomic medicine is. But I would say all of these tests do play into genomic medicine and precision medicine ultimately as well. So you may have seen, clinical and diagnostic testing before. It's doctor ordered. It's usually meant to diagnose or assess risk for developing a genetic condition. It's also helpful in kind of determining the risk of cancer, if that's something that's in your family history that your doctor is looking out for. But next to that, we have direct-to-consumer testing, which you can purchase just off the internet. And while it does give information about ancestry and things like that, there are also 23andMe tests specifically that do offer pharmacogenetics testing and other medical decision-making results. So I think it's just important to be careful of that, just because you get these results and you may not necessarily know what they mean or what you should do now that you have those results. I think another really big growing area is tumor testing and cancer testing, where we'll analyze the tumor's abnormalities to determine a treatment plan. A lot of times your tumor, if it's cancerous, has its really own unique DNA as it's growing. And so to be able to understand that, we can really target medication. So as for an example, Herceptin, which is used in a specific type of breast cancer, can only be used if that tumor is positive for that HER2 receptor, for like an overgrowth of that HER2 receptor. And it's really not functional unless you have that specific type of tumor. So I think that's really interesting. And then finally, too, you've probably seen prenatal testing on a pregnant woman that might be at risk for a family history of other genetic disorders, and that can also just help us to understand if their baby might be at risk for those certain disorders. So taking all that information together, kind of the pros and cons of should you get genetic testing done or not. I think there are a lot of pros for pharmacogenomics testing, definitely more safe and effective treatments. You're saving time and money by not doing this trial and error approach to medications, and you're saving money by not spending money on those different medications that aren't working for you. And of course, improving quality of life by trying to limit those side effects. I think with the other types of genetic testings, those pros also exist, but there are some more cons. Pharmacogenomics testing too can be expensive. Insurance coverage is not very extensive as far as I can tell at this time, but there are genetic tests out there for around $100. So it just depends on what you're trying to find out as well. I think it's also important to note that results can possibly cause anxiety if you get a test back that says you're at risk for, cancer. And it's something you just kind of have to live with the knowledge going forward. Will you or won't you? What can you do to prevent it? So it can be anxiety inducing if you're doing it on your own. Or on the other hand, it may not have any impacts. There are a lot of reasons why drugs don't work in our body, why we have adverse effects. And we just simply don't know enough about our genome yet to pinpoint an exact answer sometimes. So it kind of may not give you any benefit at all. And then finally, there are privacy concerns. If you do send out your genetic information to somewhere, what insurance companies can do with that information. The GINA Act does protect us against discrimination for employment and medical insurance, but life insurance and other types of insurance, there currently exists no such protection. So important to keep in mind. And overall, I think it's important to talk with your doctor or a licensed genetic counselor if you're interested in those kinds of tests rather than doing it on your own. So in summary, and to kind of talk about the future, pharmacogenomics is, as a component of genomic medicine and precision medicine, is an exciting and developing tool, but it's not meant to be used on its own, but it's definitely going to help more easily and precisely guide medication management. So, and still with that, more is yet to be known about the conclusive helpfulness of that genetic information compared to this trial and error approach. It's been working for the majority of us. Why fix what's not broken? But I think that is definitely a helpful tool in addition to clinical judgment from a doctor, but definitely not the end all be all, just with our limited information. And overall, genomic medicine definitely has some exciting benefits to our population health. The future is exciting to kind of start diagnosing and preventing, and then of course treating everything from major diseases to much more rare diseases just based on genetic information. So very interesting. I have some of my references here if you'd like to take a look, and I can try to answer some questions. It's definitely a complicated area.
Excellent topic. Well done, Jules. Excellent one to finish on. And if anybody has any questions for Jules or For those of you that are still here, if anything has come up from any of the earlier ones, at the end of Jules, when I let her off the hook, I will if you have any questions concerning the other presentations, feel free to ask. And I agree, Jules with the comment, well done. Very well done. So I see nobody new unmuting themselves. So